Well, good morning, everyone. It is 11 o'clock Eastern, so we're going to go ahead and get started. Welcome to day 2 of ACU's 2020 virtual conference. And welcome to this session, Supporting Community Health Workers to Enhance Effectiveness in Advanced Primary Care Settings. My name is Suzanne Spear. I'm the Senior Director of Workforce Development here at ACU, and I am going to be serving as the moderator for today's session. Just a couple of housekeeping items before we get started. So this session is eligible for 1 CME credit. In order to receive that credit, we'll do a couple things. We'll check your attendance for the session, and you will need to complete the evaluation at the end of the session that pops up when you close out of WebEx at the end. If you happen to miss the pop-up evaluation, you can access the evaluation through the Crowd Compass on the session page in the Crowd Compass app. If you haven't logged into Crowd Compass, I would highly recommend that you do that. It's got all of the sessions for our virtual conference, speaker information, and ways to interact with each other. And there are also prizes too to go in and look at all the things there. So a few more housekeeping items. We would love for you to use the questions box, the Q&A box at the very bottom of your right-hand part of your screen. You can make it bigger so you can enter your questions there. Feel free to enter your questions there at any time during the session. We are going to be holding those to the end, but don't feel like you have to wait to enter them as you're thinking of them during the session. Feel free to use the chat box to message our host, Mariah Blake, who is here and awaiting to help you with any technical issues that might arise. We are recording, and it will be available on the Crowd Compass app within about 3 days. And the session slides will also be there as well. So again, make sure you check out Crowd Compass for all the great information there. And again, even if you aren't applying for your CME credit, please fill out the session evaluation so we can use it to better our work in the future. I want to introduce our speakers for today's presentation. They are Seth Doyle, who is the director. I'm getting all tongue-tied this morning. I really apologize, you guys. He is the Director of Strategic Initiatives for the Northwest Regional Primary Care Association. And joined with Seth today is Dr. Paul Milinkovich, and he is the Clinical Advisor for the RCHN Community Health Foundation. You can read all about them on our Crowd Compass app and learn a little bit more about what their backgrounds and what they bring to the table. So with that, I'm going to hand it over to Dr. Milinkovich, and he is going to start our presentation off.
Good morning, everyone. I welcome you to the session. I just want to spend a little time talking about the initiative that RCHN has done around population health. RCHN is a private not-for-profit. Oh, actually, first thing I want to do is talk about learning objectives, just to review what we're trying to achieve with this session. We want to summarize the contributions that community health workers have made to the primary care team, to discover the potential for community health workers in an integrated behavioral health primary care setting, and to explain the need for leadership in developing and advocating for this enhanced primary care team model. The RCHN is a private not-for-profit foundation that was established in 2006 to support community health centers through research, policy, and transformation. The Population Health Initiative began about 5 years ago and has, over the last few years, had 2 cohorts of grantees that have been involved in the initiative, and I'm going to talk a little bit about what they have done. The aims of the initiative and program were to support community health centers to fulfill their mission as a provider of comprehensive primary care and as a positive change agent for at-risk populations in the communities that they serve. The goal was to support community health centers in improving their population health management capacity, their capacity to identify, and engage and manage health of defined populations, to deepen the features of the patient-centered medical home, influence of the social determinants of health as a way to improve health outcomes was a significant part of the work as well, and the encouragement of collaborations amongst different actors in the communities was a goal as well. There were a number of outcome objectives, and I will just touch on these. The strengthening capacity for population health management, allowing and assisting community health centers to develop and implement interventions to improve population health, strengthening partnerships, enhancing the potential for sustainability of these interventions, and lastly, developing a learning community to share information that was learned through the initiative. I think it's important to think, as we talk about this, what we're really talking about in population health. Total population health, as defined by the CDC, is the opportunity for healthcare systems, agencies, and organizations to work together to improve the health outcomes of the communities they serve. And in thinking about population health, it's important to think that really our goal is to improve the population, but in higher community. Inherent in this is the development of non-traditional partnerships, partnerships between public health, industry, academia, healthcare, local government, and others to achieve health outcomes. And although many times community health centers are working with a panel population, the goal would be to align panel population health efforts with total population health efforts in the community. Throughout the initiative, we believe that population health management was essential as a component of practice transformation to advance primary care. Important to document the value of the care that is provided in the primary care setting, and to promote sustainability in the evolving healthcare initiatives. In the first round of initiatives that were funded by the foundation, there were really a couple of different groups. One group of initiatives looked at improving the health outcomes of a population in a defined geographic area. In Erie County, Ohio, looking at African American infant mortality, in Chinatown, in New York's Chinatown, smoking reduction. There were a number of projects that were funded that were really looking at improving the health of a defined population within a health center. And you can see those on your slides here: diabetes, homeless individuals, improving colorectal and other cancer screenings, and reducing pediatric emergency room utilization. The projects in round two mostly focused on interventions of a population within the health center system of care. There were two projects that looked at a fresh fruit and vegetable prescription intervention for patients with poorly controlled diabetes. One was in Maricopa County, Nogales, Arizona, and another one was in Idaho. There was a project in Los Angeles to address pediatric asthma patients, a project in Chicago to integrate the health home for patients with significant mental health and substance abuse disorders, and a project in Boston for high acuity transgender patients with high utilization. There were also two planning grants that the foundation funded. One was to improve care for incarcerated youth in Georgia with the Georgia PCA, and a program through the Northwest Regional Primary Care Association to look at how community health workers worked in integrated primary care settings. You'll hear more about this project as we get further into the presentation, and Seth will be talking more about it. There were a number of different types of interventions that were developed through all of these projects over a number of years. And you can see what kinds of things health centers or PCAs did to address the health issues that were identified. Many of them added staff for care coordination and case management. A number of them added staff for quality improvement. They developed interventions for larger populations that were focused on social determinants of health, like food insecurity, housing insecurity. Almost all of the projects expanded their collaborations with either existing collaborators or new collaborators to carry out their initiative. A number of the projects work with Medicaid agencies to develop support for new payment structures to support the interventions. And throughout the initiative, we worked to develop an ongoing learning community among the grantees to advance the knowledge of all of the grantees involved in the program. Pertinent to this discussion, there were a large number of the projects that use community health workers as an intervention to achieve their goals. St. John's Well Child and Family Center in Los Angeles employed community health workers to do home visits to provide care management and asthma education for pediatric asthma patients. Mariposa Community Health Center employed community health workers to perform home visits, to do care management, and to provide nutritional education for patients with poorly controlled diabetes. In Erie County, care management and for pre- and postnatal patients to improve their health outcomes was provided by community health workers. And as I mentioned earlier, the Northwest Regional Primary Care Association assessed how community health workers were being used in integrated health and behavioral health settings. I'm going to stop here and pass it on to the my co-presenter, Seth. But before I do that, I want to ask, Suzanne, were you able to determine the audience?
Sure. If you'd like for us to go ahead and launch that poll, we can. Mariah can go ahead and launch that if you'd like.
Why don't you launch both of the polls right now?
Okay. Well, then we'll go ahead and launch the first one right now. And so this poll is going to ask you all, the participants, to indicate your role within your organization. So are you a clinician or a provider? Are you a manager or administrator within your organization? Are you a community health worker? Or do you play another role at your health center? So we'll leave that open for about 30 more seconds. So Dr. Paul Milinkovich and Seth Dole can get an idea of your role within the organization. And then once that is completed and we have an idea of who's on the line, then we'll launch our second poll. All right, we'll leave that open for about 5 more seconds. Actually, we just closed it. And now, Mariah, I cannot see the results of that poll. I think it might take a minute to come up, but if you wouldn't mind, if you can see it on your end, if you wouldn't mind, oh, there we go. It looks like, let's see here. It looks like we have there were 9% of the folks on the line are providers, 34% are administrators or managers, didn't have any community health workers, and we had 16% in the other category. So the majority are, looks like they're administrators or managers. Thanks, you guys, for participating with that. And then for our next poll question, it asks, do you currently have any community health workers in your organization? So yes, A, B for no, or C, unsure. And we'll go ahead and leave that open for about 30 seconds so you guys can answer that. And so Paul and Seth can get an idea if you all have community health workers in your organization currently. All right. So thank you guys for answering that one. So it looks like 28% do currently have community health workers in their organization, and 25% said no, they do not, and then 3% said they were unsure. So a pretty even split between yes and no, with a little bit more on the yes side.
So Seth, I think I've passed this on to you. I'm going to mute myself.
Great, thanks, Paul, and thank you, Suzanne, and everyone at ACU for having us here this morning. Pleased to be able to share more about the, about the project that we did with the RCHN Community Health Foundation and through the Population Health Initiative. The reason for those couple of poll questions, most of the work that we did on this project engaged community health workers first and foremost, but also we were very intentional about seeking out perspectives of folks that have an administrative role or a management role in the health center, as well as those who are providers, whether of primary care or behavioral health services. So those were really the three categories that we targeted for the project. And then it's helpful just to have an idea of, for those of you who are on the line this morning, how many of you have community health workers in your organization. So that's great. So thanks for that information. As was mentioned at the start, I'm Seth Doyle, and I work for the Northwest Regional Primary Care Association. We're a regional primary care association for the Region 10 states, so that's Alaska, Idaho, Oregon, and Washington. And we've had a lot of projects over the years to support community health workers, and this project that we did with RCHN was an opportunity for us to learn more about how community health workers are being integrated into health center settings, specifically with a focus on understanding the role that they play, or whether or not they play a role even with integrated behavioral health services. So I'm going to basically break up this presentation in a couple of parts. The first, I'm going to give a little history and context of community health workers and talk about how they've really come more into the mainstream in healthcare in recent years. And then the second part, I'll go into more of a summary and the highlights of our findings before we have some time for questions and discussion. So in thinking about who community health workers are, the first thing that I really want to note is that what we've really seen as the emergence of community health workers here in the United States really parallels the growth of the community health center program itself. And so I imagine most or all of you are likely familiar with the pieces of legislation that really set in motion the health center program nationally, the first being the Migrant Health Act of 1962 and then the Economic Opportunity Act of 1964. Both of these pieces of legislation authorized funding to provide healthcare services to underserved populations through community-based organizations, hospitals, health departments, and it's really what laid the foundation for what eventually would become the health center program as we know it today. What you may not know necessarily is that in both pieces of legislation, there was also funding that authorized the use of outreach workers to either go out to migrant camps or to go out into low-income neighborhoods and provide health education services to connect community members to resources, make referrals into healthcare organizations and other social services. So there's really a strong connection between both the funding that initially laid that foundation for health center programs, as well as resources to support community health workers and outreach workers. Now, the funding for community health workers and outreach workers has not been as constant or consistent by any means as what we've seen in the health center field. But nonetheless, I think it is important to call out that there is that parallel between the health center program and the community health workers. And then the other thing that I think is important to note here is in 1968, Indian Health Services established the Community Health Representative Program. And this is the longest continuously funded program at the federal level of a community health worker type program. So community health representatives work with tribal communities and very much function in many of the same roles as what we understand today as community health workers. They are members of the community that they serve. They have a real focus on providing social support services, health education services, referring into resources, addressing social determinants of health. So a lot of what we have come to understand the role of community health workers generally is something that community health representatives have been doing now for 60 years. So that's, I think, another thing that's important to call out. So this here is a quote from none other than Dr. Jack Geiger, who, again, as I'm sure most of you know, or all of you know, is considered one of the founders of the Community Health Center program. And this comes from a presentation that he gave in 2013 to the Massachusetts Association of Community Health Workers. And what he really emphasized as part of his talk is that community health workers played an integral role in the growth of the Community Health Center program. And they were absolutely instrumental in the work that was happening in Mississippi in the 1960s, the community organizing work that was going into establishing the Duff's Delta Health Center. And he mentions as part of his presentation, and it's the quote that I have here on this slide, is that we are rediscovering the value and role of community health workers. And I've got to add, it's about time. So I think that really, again, demonstrates that there's a really close connection between community health workers and community health centers that has been there from the start. And we have a real opportunity now to reimagine the role that community health workers can play as part of healthcare delivery systems, and in particular within community health centers. So I'm going to spend just a few minutes here talking about some of the more recent areas of growth of the community health worker field and how we have seen increased attention and recognition to community health workers. The first being in 2010 that we saw for the first time the Bureau of Labor Statistics created its own separate standard occupational classification for community health workers. And this is something that folks at a national level had been advocating for some time, is to have that kind of recognition of community health workers and to see them, again, have their own occupational classification. So that was a real win at the time, and that was also at a point where right around that same time that the Affordable Care Act passed, and so we started to see more of an increase on the role that community health workers could play in a variety of different healthcare and public health settings. So that was really one of the major steps that started to increase the amount of recognition that we were seeing in the community health worker field. And then the other thing that I really want to call out is that the American Public Health Association for many, many years acted as kind of a default national organization of community health workers through initially what was their special primary interest group, and then later grew into a section of the American Public Health Association. And the definition that's on this slide, which is the definition that's really most commonly used across the country for community health workers, was created by members of the special primary interest group of the American Public Health Association. So there's a lot of the advocacy efforts through APHA and calling out the role of community health workers and really bringing more visibility and more recognition to the community health worker profession. I'll add that in the last year and a half, there's been a National Association of Community Health Workers that has been created. A number of the folks who were involved in the APHA efforts for a number of years are also involved in that effort. And so if you want to learn more about community health workers at a national level, I would certainly recommend taking a look at the work that the National Association of Community Health Workers is doing. So what makes a community health worker a community health worker? Well, in our experiences from the work that we've done with community health workers in our region, as well as what we've learned from others nationally, is that there's some defining characteristics. First and foremost, community health workers are trusted members of the communities being served. That's something that's really unique to the community health worker profession, that that by virtue of being a member of that community, they have that established trust and they have that ability to really work effectively with the communities and individuals that they serve. They have some sort of shared life experience, and so that can be along the lines of language or culture or race, ethnicity. These are, I think, oftentimes some of the things that first come to mind when we think about the work of community health workers. However, there are also other areas of shared life experience where we see community health workers working, and that can be around sexual orientation or gender identity. That can be around socioeconomic circumstances. It can be around chronic disease conditions. We see a lot of community health workers who work in the HIV space, for example, who are working through that shared experience with that condition. And we see a lot of community health workers in a behavioral health space who work as peer support counselors. So in working for community mental health organizations or for behavioral health organizations, and that was one of the things that we learned in our project. And then finally, and this is certainly something that's the most difficult to be able to quantify, but this idea that community health workers really have a strong desire to help community, that they're driven by this sense of mission, by this sense of social justice. For those of you that maybe have worked with promotoras, for example, you hear a lot about the corazón for doing the work, having the heart to do the work. And this isn't to say that this is something that's unique to community health workers by any means. Certainly, I think a lot of people who work in healthcare and community health centers specifically have this sense of mission and this sense of social justice. That said, I think it's a framework that for many community health workers and promotoras and outreach workers and others, that there's a real sense of shared identity and solidarity in the work that they do to advance social justice causes. One of the things that's important to note with community health workers is that community health worker is an umbrella term. There are a lot of different titles in use for community health workers. One of the reasons why asking the poll question of do you have community health workers in your organization, yes, no, unsure, is that you may have community health workers in your organization, but they're called something different. And maybe they're called one of the titles that you see here on this slide, or perhaps they're called something different altogether. But there's a lot of different, a lot of different titles in play for community health workers. Some of the more common ones that we see in the health center space are outreach workers or promotoras de salud or patient navigators. But there are other examples here as well that really show the range of roles that community health workers play, and that really comes in through how they're titled inside of their organization. So understanding that there's a lot of different titles in play for community health workers, I think is important for being able to effectively integrate them into systems as well. So I won't go into detail in these next couple of slides. They're really here mostly as a reference for folks who are interested to be able to go and learn more. The Community Health Worker Core Consensus Project, which is the source that's cited here on this slide and on the next slide, was a national effort that brought together community health workers as well as community health worker allies, advocates, researchers, and others to really identify what are the core skills, roles, and competencies of community health workers? And through that report, we have a really good understanding of those core roles, skills, and competencies. And so it's something that I would certainly encourage any community health center organization that has community health workers or who has an interest in integrating community health workers to have a look at that report and to use it as at least as a starting place to understand the CHW workforce, and to also look at it through a lens of potential professional development and training opportunities for community health workers to further build out the skill sets that they have inside of your organizations. So on this slide here, you can see what are identified as the core skills. On this next slide, these are what are identified as the core roles. So again, I'm not going to go through each of them here, but just want to put it up on the screen for a moment so you have a chance to take a quick look. And again, the Community Health Worker Core Consensus Project, or what it's known as the C3 project. So definitely encourage folks to take a look at that. So when we think about the range of roles that community health workers play, one of the things that I think is really important to call out is how diverse the community health worker profession is, and a range of roles that they can play, not only in healthcare, but also in public health and in other social services and support services. And so if we think about what affects health, and here on this slide, you're seeing the health impact pyramid. This came out of the work of Dr. Tom Frieden, a former CDC director. And on this pyramid, you're seeing the examples of the kinds of things that have the smallest impact on improving health versus those things that have the largest impact on improving health. And it's important to note here that we're talking about health in a population level. So thinking about, across a population, what's really going to have the most impact on health. And so at the top of the pyramid, we see things like counseling and education and clinical interventions. And this is a role for community health workers who are integrated in healthcare settings that they absolutely play. There's a lot of health education that they do. There's care coordination and navigation that they do, especially for high-risk patient populations and those that are struggling to manage chronic conditions. But when we get a little bit further down the pyramid, we begin to see the sorts of examples of things that really affect health at a larger population level and are a little bit more difficult to be able to tackle, certainly in a healthcare setting anyway. And that's looking at issues like how do we change the context of people's lives and how do we address some of the socioeconomic factors that are contributing to poorer health outcomes. And community health workers here, too, can play an important role as community organizers and as catalysts for social change in their communities. And there are examples of community health workers who are engaged in that type of work. CDC, for example, has funded projects through their REACH program. REACH is the Racial and Ethnic Approaches to Community Health, where community health workers have had an emphasis on doing some of that community organizing work to improve health at a population level. This is all of this, I think, is incredibly important, especially in the context of the year 2020 that we're all experiencing right now, and seeing the ways in which COVID has really exacerbated health disparities and health inequities, particularly among Black, Indigenous, and people of color. The ways in which we're seeing how racial inequities and social inequities and systemic racism contribute to poorer health outcomes as well, that there's an opportunity here for community health workers to be engaged in this type of work to really be agents of change for improving health at a population level. So this quote from Dr. Stephen Wolf, which reads, "One of the first objectives for family physicians is to understand the living conditions patients face when they leave our office or when they leave the hospital. What is the social and environmental context they are going back to? How does it affect treatment plans?" So it's an important consideration for family physicians, certainly, and I would make the case that community health workers are really the workforce that's most prepared to be able to then act on the answers to these questions. So certainly family physicians and other members of the provider team should be thinking about these things and should be asking these questions. And then it's really the community health workers who are in many ways in the best position to be able to work with those patients who are struggling to meet unmet social needs. So what we've seen in the last 10 years, really, since the Affordable Care Act passed, is more and more integration of community health workers into healthcare delivery systems and into public health. We've seen examples of that through the Medicaid expansion and marketplace, where we've, community health workers who are function as outreach and enrollment work, or helping to do the work of certified application counselors, for example. We've seen it through some of the CMS Innovation Center work, and especially with some of the pilot projects to address payment reform and value-based care that community health workers who are written into some of those pilot projects around value-based care. We've seen examples of good return on investment there. Community health workers who are playing a role as part of patient-centered medical home and the focus there on team-based care in particular, as well as with accountable care organizations. In our region, we've got coordinated care organizations in Oregon and accountable communities of health in Washington, and in both states, community health workers are playing an essential role as part of both of those models. And then in terms of some of the broader population-based strategies, like through CDC's Prevention and Public Health Fund and the REACH program that I mentioned earlier. So there are a lot of different ways that in the last 10 years we've been seeing community health workers integrated across healthcare and public health delivery systems. So now I'm going to transition into sharing some of the highlights and some of the findings from our project, as well as what we would offer up as some recommendations. So as Paul mentioned earlier, this was a planning grant, and we had some key deliverables that are identified here. The first was to pull together an advisory committee, the second to conduct a literature review, then to do a survey, to convene some focus groups. We convened a total of 5 focus groups with participants ranging from community health workers, as well as administrators, managers, clinicians, and some others. And then finally to write up a concept paper, which we're still in the final steps of completing that, and certainly when it's done and available, we would be happy to share that out. So right off the bat, one of the first things that really became apparent to us as we embarked on this project was that when we were asking the questions about community health workers and their integration into behavioral health, we saw that there was kind of this tendency for some folks to really answer that question through a mental health lens, and then others to answer that question through more of an emotional wellness lens. And what we found is that, when we asked the question of providers or even to managers and administrators to some extent, that the response tended to be, well, our community health workers don't do behavioral health. We have, licensed clinical social workers. We have behavioral health providers, maybe psychiatrists, maybe psychologists, but, for the most part, licensed clinical social workers tends to be the folks in the health center that are doing the kind of behavioral health work. But it's not really something that community health workers do. When we asked this question to community health workers, the response was, well, behavioral health is all that we do. So right away, we had this disconnect between a recognition of the role that community health workers play in a behavioral health context. And so what we saw on the part of, from responses from providers, and again, to some extent from administrators and managers, was really more of a clinical focus on mental health around issues of diagnosis and treatment. Whereas when we probed with community health workers, we learned that it was more of a holistic sense of addressing social determinants of health, and for people who are, struggling to manage a chronic condition or whatever it might be, they might also have something else going on in their life, and the community health worker is there to be a support for that person to help them navigate whatever that other thing is. And it wouldn't necessarily be named. It wouldn't get, it wouldn't be called depression or anxiety, but there would be a recognition that there's something that's going on that's causing this particular person to struggle, with managing their health. So that was something that, again, right away we identified as this is a gap, and we want to try to bridge this gap. So I'm going to share some of the responses to some survey questions and just to give you an idea of what some of the findings were. So one of the questions that we asked was around the behavioral health activities that community health workers engage in at your organization. And you can see here on this slide, we've provided the most common 5 responses as well as the least common 5 responses to give you an idea. And not surprisingly, right on the top is the social determinants of health related activities. So a real focus of community health workers in doing that work. And then we see, other examples of, working with patients on wellness and healthy living, for example, doing outreach work. So some of the things that are more, I would say, traditionally thought of in terms of the work that community health workers do. In the least common responses, we see, substance use disorder. And again, not surprising, community health workers are often don't have training to be able to engage in work around substance use disorder. To some extent, we see a little bit of that in Oregon with some of the work that has happened there, but by and large, it's not an area where we've seen a lot of training or professional development opportunities for community health workers to engage in this type of work. And then we see, other examples that, coordinating or managing support groups. Immigration education, this was an interesting one because I think for some health centers and for some community health workers, there's a real focus on immigration issues and how it affects people's behavioral health and mental health. But I think that really varies based on the health center and whether or not it's a health center that's serving a large immigrant population. So that might be one of the reasons that explains why it's in the bottom 5. For those health centers that are engaged in immigration education, we've heard that there's a tremendous toll on the mental health of their immigrant patients as a result of the current state of the rhetoric and policies. And then a couple other examples, chronic pain management, again, not something that community health workers have a lot of training to do. And then migrant camp visits, that's a very specialized thing and pretty unique to migrant health centers. So for, any health center that wasn't a migrant health center, they were unlikely to respond to that. So we also asked about integration of behavioral health, and we asked people, in your opinion, how integrated is behavioral health in your organization? And so what we found here was interesting. We see that among community health worker respondents, that they were the most likely group to say very integrated. And then among the managers and administrators and the provider respondent categories, we see somewhat integrated. So I think the interesting thing there is that for community health workers already having an orientation to behavioral health work in terms of their perception of their work, perhaps led them to be the ones who are more likely to respond that behavioral health is very integrated based on how they see themselves and the role that they play in supporting behavioral health work. So we found that to be interesting, that there was, that community health workers were the folks who were most likely to say very integrated to this question. We also asked, in your opinion, are there ways that community health workers can be better utilized to enhance behavioral health services in your organization? And we saw in all 3 categories that the answer was yes, that everyone agreed. But what we found interesting about this one is that the administrators and providers were the ones who had the highest response rate here, that 80% indicated that, yes, we believe community health workers can be better utilized. Whereas with community health workers, it was more of 2/3 who had indicated as such, and then for providers, it was just slightly more than half. And so one of the things that came out of our focus group findings, in particular among managers and administrators, and this might explain the reason for their 80% yes response to this question, is that we found that there was a lot of support for community health workers among administrators and managers. We also found that there was a lot of concern around sustainable financing for community health workers. And so until there was really an opportunity to solve that question, it was a challenge for them to think about how they can really integrate community health workers in a sustainable way. But nonetheless, we thought that this would be an interesting one to share, and we found it interesting to see that, again, that all categories indicated yes, they believe so, but it was really the administrators who had the highest rate of the yes response here. So what does this mean for ways that we can perhaps work to more effectively integrate community health workers? Well, one of the things I'm going to talk about in a minute around our recommendations is that there really ought to be a better understanding across the board inside of community health centers and other organizations that have community health workers about who community health workers are, what it is that they do, what their training is, really just a better understanding of the roles, skills, qualities that they bring. Because one of the things that we really found is that there's just a lack of understanding of that. And so you can see, a few quotes here that I think that speak to this. You see the first quote that really focuses on the work that community health workers do with social determinants of health and how that connects into, working on mental health support and specifically named substance use support services, for example. So really seeing that work of doing social determinants of health work oftentimes will bring in some of these other aspects that perhaps providers and managers of the organization aren't even aware of. They might not even know that patients are talking to community health workers about some of these issues. Second quote here, as we talked about earlier, that there's a sense that when we're talking about behavioral health, that we're talking really about mental health or addiction issues, and community health workers really see a broader focus of behavioral health activities that go beyond mental health conditions or substance use disorder. And then finally, I think one that's really applicable universally, that not enough people understand how community health workers can make a difference. And so that really leads into our recommendations, and in particular, the first recommendation that we really, better identify and clarify the range of roles of community health workers to include the impact that they have in access and utilization of health services in primary care and behavioral health settings. That's something that we think will really go a long way to being able to help integrate community health workers as part of community health centers, is just a better understanding of who they are and what they do. The second is really around training and professional development opportunities for community health workers. We at NWRPCA, we do a lot of training as a primary care association, and one of the annual conferences that we do has a real focus on professional development and training for community health workers. And it's a challenge to get folks to attend that. We, despite having a scholarship fund that we use to be able to bring community health workers to that event, it's always a struggle getting the health centers to sign off on that. And what we hear from a lot of community health workers is that they would love to come, but there's just not budget for professional development for them to be able to do so. So really investing in community health workers and in their professional development, in their training, and their growth is something that would go a long way to being able to more fully recognize the work that they can play as part of primary care behavioral health services. And so some of the things that we heard from community health workers as it relates to behavioral health integration and mental health was that there was a real desire to learn more about mental health first aid, to go through that training and certification, to learn more about motivational interviewing, among some other skill sets that are really essential as part of behavioral health primary care integration. We also recommend that some of the same training that community health workers participate in is that training is also offered to their supervisors, so that supervisors have a better sense of what it is the community health workers will be doing and the skill sets they have to be able to do, and that those supervisors then make sure that they are in constant and consistent communication with others in the organization, administrators and others on the provider team, so that they're really able to be effective advocates for the community health workers, that they know what the community health workers do, they understand what they do, and that they can be the ones that really convey that to their team members. It shouldn't be on the community health workers to have to explain themselves what it is that they do. But rather, if they have, someone who can really go to bat for them in a supervisor role, that could also go a long way in better supporting their integration. Another recommendation is that there be clear office space in the health center for community health workers. And this was an interesting one. It came up in one of the focus groups that we convened as well. That part of the challenge is that there's no space for community health workers. And so they're not visible because there isn't a space. So and we recognize that for a lot of community health centers, space is a challenge, but for those that do have the space available, to find an area where the community health workers can have a common space and a consistent space, so they're not being constantly shuffled and moved around inside the health center, but they have a place that's really designated as their own that can really raise their visibility inside their organization. And then the final recommendation is that we really think about how we can more effectively advocate for funding models that include community health workers as essential members of the primary care team. And we really see that the best opportunity to be able to do this work is through efforts around value-based care and value-based payment that as a country shift more and more towards that model, that writing community health workers into value-based care contracts, whether it's with MCOs or other payers, will really go a long way towards that sustainability, so that it's not something that's just a one-year grant or a two-year grant that's focused on diabetes education, for example, but something that's broader than that allows for community health workers to really integrate fully and to really address the range of issues that they see as members of the provider team, and so that their range of roles can really flourish as part of that provider team. So the last thought that we have here is that there's an opportunity to better integrate behavioral health and primary care, and we think that community health workers can play a key role in helping to do that by bringing together this sense of focus on the clinical issues that we see in mental health, as well as a focus that community health workers bring in more of the holistic and social determinants of health in that emotional wellness context. And that by bringing those two areas of focus together and by having community health workers really have a central role there, that health centers will be better positioned to integrate behavioral health services as part of their primary care. And so this last quote that I'll just read out loud here that comes from a community health worker reads, "We promote bonding. We combat isolation. We do the collective work. That's what we do as community health workers. We do the collective work instead of the individual work. We bring people together, and that's mental health work." So with that, I'm going to share our contact information for myself and for Paul, and then I will turn things back over to Suzanne so that we can have some questions. Suzanne, I think you're on mute.
Oh, goodness. Here I am talking. I double muted myself. So anyway, thank you to Seth and also to Paul for that really great presentation about community health workers. I know the more that I learn and dive into their role and what they do, the more excited and engaged I am about them. So thank you so much. So We have a couple questions, or at least one question in the Q&A box. Just a reminder, if you have those questions, feel free to put them in so we can go ahead and get them answered for you. So our first question is sort of a statement and a question, and I'll read it out here. So it says, thank you for the awesome presentation that speaks to the innovative team pathways to improve community health. Have you seen intra-team power differentials in which community health workers are excluded or marginalized? If so, how do you intervene and support? That's a great question.
Yeah, very, very good question, and it is something that that we have seen and that we have heard stated from community health workers, and actually one of the things that I didn't share, but I'll share now, is that with the focus groups, we had a lot of back and forth with our advisory committee about whether those focus groups should be mixed, you know, whether we should have community health workers with administrators, clinicians, et cetera. Or if community health workers should have a focus group that's really for them. In the end, at the strong recommendation of our advisory committee, we kept the focus groups separate so that the community health workers had their focus groups, and then for administrators, managers, and providers that they had a separate focus group. And the reason for that was really what's described in this comment and question, is that there's a real concern that community health workers have about power differentials, and that when they're in, you know, a space with providers and clinicians, that they feel like that their voice isn't necessarily as heard or understood. And so what we've done, what we've tried to do as an organization to address that, is to really bring it forward to our own board of directors. Our board of directors is made up mostly of CEOs of community health centers, and so we've been very intentional about making sure that we're speaking to the importance of community health workers and the value that they bring to community health centers, and making sure that our own board members are aware of that and understand that, and that hopefully that they're bringing that back inside their organizations and sharing it with their peers as well. So I think that there's a lot of advocates for community health workers out there. It's a matter of finding them and getting them to really help make the case on behalf of community health workers. Certainly, there's a lot of community health workers who have no problems standing up and speaking for themselves by any means. I would say, though, that as a group, there's a tendency to feel like there is a pretty strong power differential there, and that it's hard for them to feel like they can challenge the status quo inside their own organization sometimes.
I would just add to that, this is Paul, that power differentials within healthcare are nothing new, not just with community health workers, but with all members of the team. And I think this is part of leadership development issue. I do think that one of our recommendations, or one of Seth's recommendations, is better training of managers around how to promote equality and equity within the healthcare team, and how to allow everyone to practice at their highest level and respect what everybody brings to the team.
Yeah, absolutely. Thank you so much, Seth and Paul, for answering that really important question. That I agree, Paul, that the power differentials really do exist, no matter what the title is. And also definitely agree about your manager training there. So, okay, I've got a couple more questions. If we don't have a chance to get to them, we will answer them offline and get them to you. Okay. So our next question is, we have found that once our staff understands what community health workers can do, the number of referrals and active cases have to be monitored to prevent burnout and a sense of being overwhelmed, I guess, for the community health workers. Are there best practices available to help someone like this person better manage the CHW work?
That's a great question, and I think that looking at maybe one place that I would recommend as a possible resource would be MHP Salute. If you're not already in touch with them or familiar with them, they're one of the HRSA-funded national training technical assistance partners, similar to ACU. They have a lot of resources around community health worker integration, and I imagine they might have examples of some best practices for that. I think that is a challenge, though, that making sure that community health workers don't burn out. And in particular, what I would say is that having constant communication with the community health workers themselves and making sure that they feel like they're prepared to not only respond to the volume of referrals, but that they're prepared to respond to the types of referrals. One of the other areas that we learned in our project is that in Oregon, a number of the CCOs, the coordinated care organizations, were making referrals to health centers, to community health workers for substance use disorder, and the community health workers simply did not have the training or the preparation to deal with that, and it just created a real challenge. So checking in about the volume of referrals and also the types of referrals. Do the community health workers have the training that they need to really be able to respond to those referrals?
Yeah, I think this will vary a lot depending on what you're asking the community health workers to do. So the types of services you're requesting could determine a lot the number of referrals they can handle. It is an important question. And I think part of the issue of training providers and training clinical teams to be clear about to whom you should make a referral can allow you to better manage the volume issue that is ever present.
Great. Thank you guys for asking some great questions. And again, to Paul and Seth for being our presenters today. We are just over the top of the hour, so we want to respect your time and make sure you guys can get on your way. Please fill out the post-session evaluation, especially if you would like your CME credit. And we would encourage you guys to come back to our next session, which starts at 12:30 Eastern. And it really is, when we're talking about equity, kind of on that theme, in a different sort of way. Our next session is called Moment or a Movement. Where do we go here in delivering diversity, equity, and inclusion? So again, hope you'll join us for that. Thank you again to our presenters today for a great session and for all of our attendees for being here with us today. So with that, we're going to sign off and hope you guys hope to see you in the next session. Thanks, everybody. Take care.